A very good day to all of you. Thank you for joining us today at UNDP through this webinar to celebrate and mark the second International Day of Care and Support. I welcome you all to our webinar, Empowering Women Through Strengthened Childcare Systems, Global Insights and Local Successes for Inclusive Growth. My name is Karina Bhasin and I work as a program manager at Sustainable and Inclusive Unit of UNDP India. I am being joined by my very young, talented, and passionate colleagues, Beth and Yasmin. We are joining from the UNDP's Delhi office, and I'll be the moderator for the session today. At UNDP, the work around women's empowerment and gender equality has been happening over the years and over the decades. But this year has been a very important one because we are in the implementation phase of our very ambitious project. And it's called Boosting Female Labor Force Participation through Strengthened Urban Care Ecosystem, the project by UNDP India in partnership with BMGF, DNULM, and the Ministry of Housing and Urban Affairs. And henceforth, I would say today's discussion, this webinar is particularly timely. Despite the increase in the female labor force participation rate in India, and I would say across the globe as well, women still continues to face barriers, and especially related to childcare responsibility. With this webinar, the objective and goal today is to explore the different kind of scalable childcare models that have been strengthening or has been able to strengthen the urban childcare ecosystem and has enabled women to join the workforce and retain in the workforce, and also helping the children. And we have our very and distinct expert set of speakers as a distinguished panelist today to inform more about the same. Today, our session will feature a keynote address on the feminist principles of care work, which is followed by a presentation on the global and local childcare models, and then we'll definitely open the virtual floor for Q&A so that all the participants can bring upon their questions, can help us have new perspective and make it a more lively conversation. So I once again welcome my panelists and welcome the participants joining from different regions of the globe.
Hi, everybody. Thank you very much, Yasmin. It's a great pleasure to be here and to be participating in this webinar. So I thought, since the other speakers are going to be speaking to you about specific childcare models, I might start us off with some sort of broad framing and context and talk about feminist principles of care work. All right, so I wanted to share with you, this graph from a time use survey that was conducted in India in 2019. And I think it's would be interesting to start with this because it's quite revealing in a number of ways. So first, you can see here, that there is a big difference between the paid work and unpaid work done by men and women across, rural and urban areas in India. And you can see that, this is the difference is particularly stark in terms of the amount of paid and unpaid work done by urban males. And you can see across the categories that women are either doing as much unpaid work as paid work, or then even more. But you also see this gray bar that is an additional category on which the NSSO, which is the organization that did the survey, collected data on, which are cultural activities, leisure activities, self-care, sports, recreation, etc. And you can see also across these categories that women have less of this kind of time than men do. And so it comes out pretty clearly that women have relative time poverty as compared to men. And if we think about, if we use the term social reproduction that is used in the feminist literature, which is understood as the work of sustaining and reproducing life, we see that this social reproduction work, care work, domestic work, unpaid work that women are doing has a cost. And this cost has also been conceptualized by feminists as depletion. And you have, I've put the definition there on the slide, which explains that depletion, results when the outflow of such labor exceeds the inflow of resources for the person who's doing this work. And this kind of depletion has pretty severe material, physical, emotional consequences for women, but also social repercussions. And you can see that the problem in India, when it is, okay, I'm having some trouble moving to the next slide. Okay. Um, when you compare India to other countries, you can see that the problem is pretty severe. So this is, based on older data from 2014, but nevertheless, it shows very clearly the sort of inequality or disparity in the amount of time that women are spending as compared to men in unpaid care work. And India, in this set at least, is really the highest, and even 3 times that of Argentina, much higher than that of Bangladesh as well, which are other developing countries. So the question is, why do we think that creating gender equality in unpaid care work is important? So there are 2 ways of looking at this, and international organizations like the World Bank and IMF have argued that it is smart economics to promote gender equality, because if you have gender equality, that increases women's productivity, and it helps us to achieve greater economic growth and development. And one of the ways to do that is to close gender gaps, whether it's in in education, in pay, to empower women, to impart training, skills, etc., in order to enable women to close these gaps. And one of the arguments that's also been made, that support for childcare will proportionately increase women's paid work. But feminist economists have criticized smart economics because they argue that it is instrumentalizing women's labor, and it is focusing rather than on women's rights and well-being. It is focusing on women's productivity and their economic value. And feminists also argue that such smart economics does not actually talk about or sufficiently address the structural inequalities that produce this kind of gender division of labor in the first place, and that it's ignoring the power imbalance that are leading to disproportionate care burdens for women. So let me go to the next one. So rather, I would propose that feminists have a broader way of looking at and understanding these feminist principles to address unpaid care work. And I'm here talking to you about the 4 Rs that have been offered to us by Diane Elson. And she emphasizes that there are, it's very important for us to acknowledge the intrinsic value of care work, not only for its sort of instrumental use, because reducing care work would send more women to the labor market, but rather understanding that this care work is economically important in its own right. The work that women are doing in the household, or largely women are doing in the household, this unpaid care work, is the work that is enabling, young children to acquire the skills, acquire the socialization, the cultural norms, the education, for them to access this kind of child rearing that then produces workers itself, right? So this activity is economically important in its own right because it allows the economy to continue functioning. It provides a labor force. It also emphasizes the importance of reduction of unpaid care work, which is to reduce the labor intensity of such work by investing in physical infrastructure as well as in social infrastructure. So it could be providing, drinking water, physical transport. By social infrastructure, it would mean better health infrastructure, education, and of course, as well as publicly funded care infrastructure. There's also a great emphasis on redistributing this care work and ensuring that it is shared between family members and shared also between men and women. Right now, we saw the great inequality between the amount of unpaid care work done by men and women. That's another important principle. And of course, This also includes making sure that parental leave policies are not gendered and that paternal leave policies are given as much importance as maternal leave policies to ensure that that there are no barriers in order to redistribute this work. And finally, Diane also emphasizes the importance of representation and including care workers and caregivers in decision making about care policy itself. So I am going to leave us, okay. And in terms of how to interpret this feminist framing for childcare services in the context of India, I would urge us to use this framework to, as a grounding sort of framework within which to place childcare services. So this kind of approach would then, foreground the right to leisure, the right to equality, the right to quality care, over sort of some of the instrumental approaches. It would emphasize the fact that childcare should be universal and it should be of good quality and build on existing public services that we already have in India, such as the Anganwadi scheme, which already contains within it a more broad notion of childcare, health, and well-being. The services should be equality enhancing rather than reproducing inequalities. So we should ensure that we are not making childcare dependent on parents' employment, not disproportionately burdening older women with care jobs, not limiting access to care to those who can earn a high income. And we should be ensuring that the care work and the jobs that we are creating should be decent and should be paid well and should have social security and all the other rights that come with decent work. Another important principle here would be to understand the intersectionalities in terms of how people from different castes, religions, and castes can access this care, and to build that into the policy design. And building on the redistribution principle, the degendering of care work and sharing of care work would be equally important. And finally, this webinar is a step in that direction, but it requires a broad participation of various stakeholders, including those who are providing care and those who are receiving care. So I will leave it there to the rest of our expert panel and look forward to our discussion. Many thanks.
Thank you, Dr. Shiba, for that very comprehensive overview. I would like to now begin with our very important segment of this webinar and would like to invite Dr. Valeria to kindly share about the national care systems in Latin America. Over to you, Dr. Valeria.
Thank you. Thank you very much. Wonderful to be with you. Here is early morning in Geneva. I'm not sure if I can move this. Not yet. You can control. Okay, excellent. So my presentation, and I will try to make it into 6 minutes. I'm not sure I will succeed. I will try my best. Follows very, very well from Shiba's, because in a nutshell, is to explain how this feminist approach to care has been taken on board at international levels. I wanted to start by a definition of what care policies are, because care policies cut across several domains, including public service provision, infrastructure, social protection, and labor policy. So care policies are those public policies that allocate resources in the form of money, services, or time to caregivers and the people who need care. They are framed in the SDG 5, Target 5.4, which says recognize and value unpaid care and domestic work through the provision of public services, infrastructure, and social protection policies. I'm trying to move this, but I am not succeeding. So can you move to the following, please? Okay, thank you. So 2 definitions here. 1, transformative care policies simultaneously guarantee the rights of care receivers and caregivers, as well as their agency, autonomy, and ultimately well-being. And that's a definition from the report of Andrest in 2016, taken on board afterwards in the report of 2018. But we are emerging just this year from the tripartite general discussion in the ILO that has agreed on actions with regards to the care economy, to decent work and the care economy. And the next one is an excerpt from that resolution that says integrated and coherent care policies and systems should contribute to rights-based approach to care and be grounded in international labor standards and social dialogue. The 5R framework for decent care work provides valuable guidance in this regard. And as Shiba mentioned, the 5R framework follows on that initial contribution of Diane Elson in 2008. I dated much before because our report is 2015 and 18. But what the ILO did expand on is on these two other R's that are related to the the conditions of care workers. So recognize, reduce, and redistribute unpaid care work, and represent and reward properly paid care workers, the paid care work. Can we move to the following one? I'm sorry, I cannot do it myself. So I wanted to bring the example of Latin America, in particular, the regional agreement reflected in the Buenos Aires commitment at the end, November 2022, so almost two years now. So one point that I think it's important, and it has to do with the creation of this International Day of Care as Support, is the recognition of care as a right to provide and receive care and to exercise self-care based on principles of equality, universality, and social and gender co-responsibility. And the Buenos Aires commitment emphasizes that we need to foster comprehensive care systems within a broader strategy of a transformative recovery for women. Next, please. And so in Latin America, and let's put all of them, there has been a very important progress in framing very fragmented and disparate care services within national care. I think there is one missing there. Within national care systems. And what are these systems? And the Uruguayan example is the one, it was the first, not the last, but it was the one that is more illuminating. And these systems have several characteristics, but one is the objective of avoiding fragmentation and get coordination across different providers of care, across different spheres within government, and across different populations, so as children, for example, don't fall through the cracks between the leave period or the fact that informal women workers don't get any leave and the beginning of early childhood education, and then fall through the cracks of the health system that doesn't provide long-term care. So the idea is that on this rights-based and gender-responsive framework, there are comprehensive approaches. And this comprehensiveness is transformative precisely because it doesn't pay attention only to those who need to receive care or only those who provide care in the unpaid care economy, nor only those that are care workers, including domestic workers, but to the whole, and to understand how the functioning of different services and dimensions and policies come together. So one last or two last messages, and I think I'm done with my time. one important message, please, is that the quality of the care provided in care services by care workers is in direct relation to their quality of working, their working conditions. So these two have to come together. We cannot progress in providing care services without decent work for care workers. And the second is that these investments are costly and that we need investments to be costed and the fiscal space to fund these investments. It won't happen from one day to the other, but the experience of Latin America teaches us that the view has to be universal and within a universal social protection approach, and then the steps towards it have to prioritize those more in need so as not to leave anyone behind. Thank you very much. I'll stop there.
Thank you, Dr. Valeria. Thank you for this presentation. It's really, really helpful. I would request Ms. Xiongmi to come and to kindly present the role present on the role of state in providing quality care for all and the very special model Idol Bomb. Yes, please, over to you.
Hello everyone, I'm Song Mio from the Ministry of Gender Equality and Family, and then I'm very happy to participate in this important webinar. I'd like to introduce the Idolbom Childcare Service and our policy approach to enhance its operations. Before I start, I'd like to let you know some Koreans. So Idolbom Service, it is called Idolbom Service, but it calls I means children or child, and 돌봄 means care. So 돌봄 service means childcare service in Korean. And then the care work is significantly contribute to women's economic empowerment and social equality, being one of the most essential elements that sustain society. Providing high quality care services instead of placing the burden solely on parents, especially women, is a crucial step toward economic development and gender equality for entire society. The Korean government is committed to providing quality care services while increasing the value of care work. So I'd like to introduce a national child care program called Idolbom Service briefly. The Korean government has been providing various services to alleviate the childcare burden, such as free childcare for infant and toddlers and after-school care for elementary students. However, gaps in care coverage remain, which needed to be addressed. So in 2012, the Ministry of Gender Equality and Family introduced a one-on-one personalized Idolbom childcare service, fetching caregivers to household to assist in dual incomes and single-parent families with child caring. The service includes two types, full-time and part-time care. Part-time care is for children under 12 years old with a government support up to 960 hours of care per year. The full-time care service is for infants under 33 months with a government support up to 200 hours of care per month. Next slide, please. The service fee is $8.95 per hour. There are 4 income categories based on the median income standard. And for example, for category A, below 75% up to $7.60 per hour is subsidized by government, and category D, with over 150% of the median income standard, needs to pay full amount of the service fee. The number of households using the service has steadily increased, reaching around 86,000 households in 2023, a 31% increase compared to 5 years ago. According to the satisfaction survey, more than 98% of these households answered that they want to continue to use the service. In 2023, the service supported over 200,000 children, more than doubling the number compared to 5 years ago. Next slide, please. So I'd like to talk about the caregivers. The the government provide 160 hours of professional training and conduct criminal background check and aptitude test and interviews to train public childcare service workers, 아이 돌보미. To ensure high quality service, all 아이 돌보미 are required to undergo 16 hours of additional training annually. And as of 2023, approximately more than 28,000 아이 돌보미 caregiver are actively working. The service fee is consistently increasing. It is 8.95 US dollars per hour, which is 118% of the minimum wage. Next slide, please. Next slide, please. So the Ministry of Gender Equality, the Ministry of Gender Equality and Family launched this task force in 2023 to achieve the goal of creating idle service that everyone can trust, and subsequently now announced strategies for the enhancing the service, because the service was introduced 12 years, and we think that it's a time to kind of enhance this service. So I'd like to introduce very briefly about the plan. The plan consists of three categories. The first one is optimizing the service delivery system, and second one is enhancing caregiver professionalism, and then diversifying services and rationalizing fees. So through discussions with service users and caregivers and service providers and experts, all with relevant multi-stakeholders, the ministry identified key problems and developed effective solutions. Firstly, we optimized the service delivery system. So regarding supply, there is a shortage of service providers, leading to difficulties in matching caregivers with families, and there are regional disparities in service availability. So we plan to expand the number of service providers and operate more regional support centers to improve accessibility and ensure consistent care service nationwide. Regarding convenience, the current matching process between caregivers and parents is manual and time-consuming. So we are introducing an AI-based integrated support platform to make the caregivers parents matching process faster and more accurate, providing more convenience for parents. Regarding quality of care, there is insufficient regulations and quality assurance for private care providers, which can affect the safety and consistency of services. So a registration system for private care providers will be introduced, and requiring them to meet government standards for training and safety to ensure service quality and increase trust. Next slide, please. Secondly, we enhance caregiver professionalism. Regarding the training caregivers, the level of education and professionalism among caregivers varies by region, and there is a lack of systematic training and certification for private caregivers. So we introduced integrated care training programs last year that include private caregivers ensuring systematic management based on certification. So this will guarantee consistent service quality. Regarding working conditions, the caregivers face poor working conditions, leading to a high turnover rate and difficulty retaining skilled workers. So we plan to improve working conditions and establish retraining programs to create an environment where skilled caregivers can be retained for long term. Next slide, please. So lastly, we diversified services and rationalized fees. Regarding flexible services, there is a lack of suitable emergency care services for families needing urgent care, and the service supply of short-term care does not meet demand. So we will expand emergency and short-term care services to flexibly respond to the diverse need of parents. Regarding cost, the cost burden on users remain high, especially for low-income and vulnerable families. So we plan to expand financial support for the dual income families with the income below 150% of the median, and as well as for the single parent, parent with disabilities, and an adolescent parent, ensure that more families can access care service without financial strain. So the Idolbom service plays a central role in the care economy as a high-quality service provided by government. We will continue to refine the service to ensure that more families and children benefit from that. Thank you for your attention.
Thank you, Ms. Kyungmi, and your presentation has also led to the activation of the Q&A. Thank you for all the participants to be so much actively listening to it. I just want to ask everyone to kindly use the section Q&A, the feature Q&A, to post your questions, and kindly write the name if you would like those questions to be addressed by one of our, like specifically by one of those one of the panelists. So please add their names as well. And yes, so moving forward, now I would request Ms. Maria to come and present the care economy case for North Macedonia, one of our very, very successful project of one of the UNDP's country office. Over to you, Maria.
Thank you, Karina. Thank you, colleagues. It's nice to be part of this group and sharing knowledge, but also learning from others' experience, different development models. So here I will present the program and the model that throughout UNDP support, the government was supported in development and establishment of the social protection system in line with the social reform that has started in 2019. Our country office has been working in development and setting the ground for development of care services and support to women to enter labor market since 2012 throughout different programs that were focused on the support of the persons that are unemployed in order to gain training and to be activated at the labor market to be more employable. So, in shortly, the care economy in our country is a system, it's a setting that it's very important from one side to tackle the needs of the unemployed people, especially women that are providing informal care services, and from the other side, in order to develop social policies and new social practices, is to support the government and the system in envisaging creation and development of the different care services for different persons in need or at all ages, starting from children until elderly. So we have, I will present three phases of the development of this system and this program that has one preparatory phases, planning and development and implementation phases, and the next step is scaling up. So we have started from 3 points. We wanted to recognize, to formalize, and to restructure the system in order the whole system to be in line with the human rights, in line with the right for care and support, but from the other side with the rights for work and employment. So in order to recognize, we have made several assessments and in direct communication with the citizens, we have identified the needs of the families for care services. Also, there were identification of the especially very large group of family members, especially women, that were providing informal or non-paid care services to their family members in need because the service system was not existent or underdeveloped. Also, the same situation in urban and also in rural area. So also our focus was to, because this system is predominantly women, predominantly women are care providers, also in informal and also formal. We also wanted to recognize the role of the men in the non-paid and to identify the role of the men in the non-paid care services. So in order to formalize, we have, based on the assessment, developed different programs and opportunities in order to provide and to formalize the unpaid care and informal care provision. So we have, based on the assessment, we have seen that we need to develop new vocational standards, new vocational programs and trainings that need to be formal, that need to be part of the training and education system, but also to be linked with the labor market and labor market needs. In order to start, we need to develop programs for the unemployed, but also for programs to develop services for the people that need services. In line with the human rights-based approach, in line with the implementation of UNCRPD, and using the principles of gender empowerment, gender equality and women empowerment in order to leave no one behind, based on the several assessments and national surveys. When we have started, as I said, we have started from the scratch, from the occupational standard. We have tried to network the Ministry of Labor and Social Policy, our partner Ministry of Education, and also Employment Service Agency in order to develop and to create labor market that will look into the future, that will have a space for transformative changes, and will be formal, and will think how to develop measures to sustain on the ground, and from the other, from one side to provide the quality jobs, and from the other side to provide quality care services. So UNDP was providing support to the government in introducing and setting the new care services and the care economy at whole in partnership. We have, as part of the operational plan of the government for employment, job activation, employment, and making more inclusive labor market, we have supported the development of the care economy measures that from one side were providing to the informal care providers training and increase their job opportunities in order to enter the labor market, to be active, and to find their job placement. And from the other side, because we have supported the institutionalization process of social services. It was a national intervention in order to transform the care system. From the other side, we have supported the development and establishment of the care services based on the needs of the people in need, including persons with disabilities, elderly, people with chronic illnesses, people that need palliative care. So for each group, based on the universal principles, respecting the specific needs of the group of citizens that need care and support to live decent and to live independently, we have developed different training programs that were verified by the Ministry of Education and Science. And from the other side, we have verified training institutions that were providing training to the unemployed people, especially women, to gain formal qualifications, to gain their skills in order to enter the labor market and provide the services according to the new system. So from the other side, we have supported the licensing procedure to the individual care providers, but also we have supported this economy to be open and to be open for the citizen association, for the NGOs that were providing care services on informal basis or were providing on a project level in order to be supported to satisfy the quality standards, the technical quality standards that were set by the government, and to establish one partnering communication with the government in order to the services to be outsourced and service providers to be new service providers to be established by the NGOs. In order to make a bigger outreach to the people that need employment, but also to the people that need care. Since social reform from 2019 until now, we have introduced a new measure that is guaranteeing the employment of the care providers with full beneficiaries. We are talking about the support for social and pension insurance, but also for support to gain a formal salary and to have to enjoy their rights as a workers and be to have health coverage. So in this period, around 500 informal care providers were trained, were licensed, and gained employment. And all those people has provided different kind of care and assistance and support services to around 80,000 people that are that need care. So we are not stopping here. We are trying to strengthen and support the government, the monitoring and evaluation system of the care services. We are talking and opening discussion about the workers' rights in order to improve and to scale up the job and to a caregiver in order to be more attractive for young people, and also to promote that care economy as an economy besides provision of training, activation, and employment for women. Also, it provides an opportunity for men to find their employment in this economy. So we are in different discussions that will lead and are leading to policy changes with the policymaker, but we are trying to support the inclusiveness and to secure the full participation of all stakeholders in order to provide an open space, these care services to be developed on a local level, especially in the urban and also rural areas in which it's a big amount of people, especially women, that are still providing services, informal care services, but to be informed and to use the opportunity for them to go through a training program and to be supported, to be licensed, and also to gain their job placement in this economy. This economy is also supported to be scaled up in order the individuals to open their own companies in order to set the services and to create new job opportunities for other unemployed people. We are also looking in the future to put on the ground and to set the table for additional further investment, not only from the donors and from the state budget, but also to put on the table and to invite the private sector to finance this and to invest in this economy, and in future to promote the public partnership in order to support from the one side the need for care provision, but from the other side to support development of the care system services and open new training opportunities and new job placement for unemployed and informal caregivers and providers. Thank you.
Also like to share with our participants that Maria has been joined by her colleague Susanna. She's the head of Inclusive Prosperity UNDP North Macedonia, and have been working in the gender equalities, working towards the gender equality strategy, advancing gender sensitive social protection and care systems, and have worked on this model with Maria. We welcome you, Susanna, as well. Moving forward, just one thing, a small request to all the participants to kindly remain with us for another 10 to 20 minutes because of the technical glitch that happened earlier. We are running late. But yeah, there are many interesting models and conversations yet to happen. So I request you to kindly have lunch while listening us. So sorry, but please. Now I would like to invite Sumitra Mishra, Sumitra from Mobile Crush, to kindly enlighten us.
Hello, everyone.
I would
Thank
say
you,
when
UNDP colleagues, for inviting me. Am I audible?
you are audible, but unfortunately not visible, Sumitra. Hello. Hi, Sumitra. Can you hear us? Sumitra, you are not audible and visible as well. Yes, you are visible. Sumitra, would you please unmute yourself? Try.
Hi.
All
Am
right.
I audible? Sorry about
Yeah.
that. I don't know what happened. Do I have the controls for changing the slides?
Yes, please.
I can't seem to be changing it, so may I request Beth to please help with it. Thank you again, UNDP colleagues. Good to be together celebrating the International Day for Care and Support on the 29th of October to be speaking about care. Very quickly, mobile crashes has been around for a very long time, primarily in starting with as early childhood development organizations with strong intersections to gender and labor issues over the last 5 decades. I can classify our role in 3 ways. First, as a demonstrator, a non-state and NGO player demonstrating childcare services for most marginalized children of the country. Secondly, as a field building organization through our technical expertise on the subject matter of ECD and creche operations, and therefore providing thought leadership. And finally, as an influencer for systemic changes through influencing laws, policies, programs, and public financing through our experience, as well as the evidence that we gain from the ground. Next slide, please. If we look at the bulk of how we operate childcare services, we kind of fit into the Care Diamond framework, where our partnerships with the governments is mostly to accelerate access to free quality childcare services for the most marginalized women workers, and their children. Our partnerships with private employers in the market model has been quite a unique feature of mobile creches over these years, where we support and facilitate employers to provide childcare as a part of their social protection obligations to their workers, predominantly through the labor laws in this country. In fact, the name mobile creches comes from the majority of migrant workers employed by these industries in the country. The third big portfolio of our work is as a field building organization, a social franchisee model with multiple civil society organizations in transferring the knowledge and the creche operations for increasing access to quality childcare again. And finally, the families or the community-based organizations. This is an increasingly emerging field over here, and I refer to what Karina mentioned in her opening remarks, where we are trying to work with UNDP and multiple other colleagues to co-create community-based solutions for childcare, including home-based care entrepreneurship models in this country. Moving on to the next slide, please. Just to say that roughly through this Care Diamond framework, this year we were kind of reaching 100,000 children to a little under 5,000 childcare services through the multiple models. Now, whatever the model may be, the scale pathway may be, or the stakeholder ecosystem may be, our core early childhood development model remains agnostic. It draws from the science of the nurturing care framework as well as aligning to multiple policy parameters. It's rooted in science, but it is adaptable to the culture of a particular context in which we are working. And of course, it is also influenced by the costs that are available in terms of public financing or replicable, demonstrable universal programs. So in a way, we do look at the ECD framework to say, what are some of the non-negotiable quality standards? What are some of the minimum quality standards, and what could be some of the desirable quality standards, and what would each of these cost? And of course, you can imagine that there is a continuum of gradation of quality standards, but non-negotiable meaning truly non-negotiable in that sense. Next slide, please. So I'm just going to deep down a little bit into one particular model because that's what I was given the feedback for us to share experiences here today in terms of our partnerships with governments at the central level with national governments, but also predominantly with state governments and even a few district governments. Some of the information that you see on the slide has really picked up post-COVID. If you see the dateline where care economy came to the forefront, it started bothering middle class people and therefore decision makers. And that has been picked up across the country. If I pick out the unique features of the Haryana partnership with the state government in Haryana, that has probably been the longest partnership. I think that's a success story that is at a cusp of being replicated across other states in the country because of some trend-setting work that Haryana as a state government has done. Odisha is interesting because that gives us a really good model for decentralized decision making about childcare services, devolved financing, public financing of childcare services. It's also a good mechanism to know how do we reach the poorest, most remotest tribal regions of this country. That's what we learned from the Odisha model. Karnataka is interesting because, and the unique feature for me in the Karnataka model is that for the first time in the country, childcare services has moved away from the domain of women and child development departments to the rural development department in Karnataka, signaling that care economy, particular childcare, is a cross-cutting policy priority for a whole of government approach rather than a siloized approach. And of course, Telangana is a new partnership, and we'll be maybe in another year, we'll come back to you with more lessons from what we learned from a partnership with the Telangana government. Next slide, please. So why are these states, taking on the responsibility of looking at publicly financed childcare services? Clearly, there is a national level policy scaffolding that is pushing it, where Government of India is prioritizing to see India in the next 20 to 25 years as one of the developed nations. Within that vision lies Government of India's commitment to look at women-led development in order to give action to women-led development. Bringing women into the workforce is a policy priority. And we all know since this morning also we've been hearing that access to good quality childcare is an enabler for getting women into the workforce. But also, secondly, remember 20-25 years from now, when India is imagined as a developed nation, the employable youth of then are infants and toddlers now. And therefore, investing in the first 1,000 days in good quality early childhood development programs has also become a priority. Which is where it brings me to this slide to say that, we as a technical organization, broadly, these are working with the state government departments to co-create the model that will work. And in co-creating the model, the standards and all of that, of course, but also the costing of how that will work. Now, if you see, we don't end with just developing the costing for a model, but for sustainability, we are also working with the government systems to find out the revenue sources. I did see a question in the Q&A to say that, where do you find the money? So the idea is to look creatively as where is the money which is untapped and unlocked, and can we have a strategic statutory lever to justify childcare, women's workforce participation, skilling, nutrition programs to unlock some of that money. Of course, our technical role in terms of training and quality and monitoring that remains quite strong. The one thing that I want to highlight here is that while we are looking at the supply piece from the government side in developing these models and increasing access through scalable models, we are also very strongly on the ground developing community demand, citizens' ownership of these childcare services. Without citizens' demand, some of these things will be hard to sustain. Anybody who's worked with government, and most of you have, you will recognize that there's a lot of responsibility in terms of administrative work, but the most important responsibility is that officers change, leaders change. Somebody has to be there to hold the continuity so that it doesn't fall through the crack, and that's one of the role that we've experienced we play. Finally, as mobile crashes, what are some of our non-negotiables with the government? I think the time for care has come, and no one can stop a good idea right now. And therefore, I can say that there are some non-negotiables for us to even enter into a government partnership. Of course, we only enter into a partnership when government commits for public financing as per the costing model that we do. No private financing, no philanthropic financing for government-run crashes. It has to be led by a senior bureaucrat because that has implications on future sustainability. Government doesn't cover our costs for all the technical support, but we insist on some part cost for our out-of-pocket expenditure. Next slide, please. Next one. No, there are two more slides. Anyway, so okay, and one last slide. Anyway, the last slide was about our exit strategy from our government. If friends can bring it up, that's great. But I just want to reiterate that how do we determine that it's time for us to leave? I think we have three big audacious goals to say that if we've achieved these goals, then it's time for us to leave. The first big goal is, of course, what we've been hearing from Dr. Shiva at the start, that, making quality early childhood development and childcare as a universal right for all children in this country. That's one big goal. The second big audacious goal is to universalize childcare as an entitlement for all workers, irrespective of men and women workers. That's the second goal. And the third goal that we've heard today since morning, and which is particularly important to bring up today, is recognizing childcare as a professional cadre with all the decent work conditions that we've heard since morning. But while these are very big audacious goals, what do we look at our work in progress goals, particularly with our state partners? The first work in progress goals is, of course, to see that we've created budget line items for childcare as a steady budget line item, and it's not limited to untied funds and flexi funds, number one. Number two, we try and see that there is a clear administrative structure that looks at childcare within the government systems, and it's not an add-on or a top-up to existing responsibilities of the government cadre. And the third work in progress goal for us to exit a state partnership would be that if we have evaluated that the state has enough technical resources, capacities, and skills and tools to run quality childcare by themselves. So with that, I'll end just to say that what is the secret sauce or the secret code for mobile crashes to work successfully with so many governments and to have a negotiation power at these government partnerships is, one, our feet on the ground. We never lose our feet on the ground in terms of demonstrating our services, also learning from our experience. Two, working with multiple partners. We know that big transformative systemic change cannot be led by a single organization, working with many, including networks, collectives, coalitions, and some trade unions sometimes. And third and important, as an NGO organization, we don't shy away from adopting technical strategies to political strategies where needed to push the needle. Thank you very much.
For sharing that technical to political strategy. I think that's much needed
to also understand that how the NGOs and CBOs work, keeping the whole ecosystem in the perspective, and try to do everything possible to push the policy in the most progressive manner. I would like to invite Suzanne Thomas from SEVA to kindly present the childcare models being led by their organization. Over to you, Suzanne.
Thank you very much, Karina, and thank you to all the panelists. Can I ask someone to help me with the slides? Yeah, thank you. So let me come straight away to the SEVA's childcare model. We're looking at the cooperative model. So obviously, when our members, the informal women workers, when they needed a safe space for their children while they were working, SEVA with the informal women workers organized them and set up their own membership-based organizations, and the cooperative model of childcare was set up about 40 years back. And it was perhaps the first of its kind. And today we have about 12 centers in Ahmedabad city, the childcare model. The creche workers and the mothers who are informal workers themselves are the shareholders, and they are the decision makers. They are the managers, they are the owners, and they are the users. So it's managed by them. And the unique feature of this cooperative is they're full-day creches. Quality standards are maintained, they're accessible to the women workers, they're affordable, and they are participatory. Like I said, the women, the mothers and the creche workers, they lead the cooperative. The next slide, please. Well, the impact, we've been hearing about the impact of childcare centers. So I'm not going to spend a lot of time on this. But yes, we have seen over the last 4 decades that women have started going back to work, and women have started earning more. And all the children who pass out from our centers in 40 years, they've gone and joined formal schools. And of course, we also have about 40% of the children who are below 3 years, young, small infants also come to the centers. And the parents are actively involved in running the centers, their active participation of fathers. And somebody asked in the chat that how do you get the men to participate? You have to organize these meetings regularly with the fathers. To begin with, they do not come, but over a period of time, their participation increases and they feel that they are part of the child's upbringing. Next slide, please. Now, moving on, I mean, there are many learnings. One of the, learnings that I would want to talk about, the second one, that the childcare centers focusing on low-income families cannot be financially sustainable because they do need matching external support. Parents do contribute, like I mentioned earlier, parents' contribution, community contribution, both mother and father, they contribute, they support, but only a third of the cost gets covered by parents. So therefore, you have to build partnerships. You have to work with the private sector. You have to work with the corporates. You have to work with the government to bring in the matching external support. And we have worked with, the corporates, and that helps us cross-subsidize, the cooperative generates revenue and brings it back to support the informal women workers, and also creates livelihood opportunities for them when we start running these centers for the corporates in the private sector. Childcare centers also, we all know that can support efforts to address malnourishment, and you have to have a holistic approach, and that is essential. Early childhood development, and we have to go beyond the sector to address issues around food security, water and sanitation, and other issues have to be addressed. Local involvement, like I said, this is a cooperative, therefore the local involvement, local participation in the operation, the decision making makes the cooperative effective, and that is a very good thing that the people run it, they themselves, they lead it. And the community contributions, community supported, community come forward because they want to do something for their children, and there is the support, and they also start recognizing the need for these kind of centers. Community involvement in all these, we have seen that the community's involvement has always been there in terms of support during crisis and during COVID. We have seen that they came forward. We were able to use the centers whenever there's a crisis. There is a partnership there at the local level, and it also ensures. And while we are ensuring an integrated approach to social security and women's economic empowerment, that comes out very clearly through these centers. And creche workers, they should get decent wages. Their work has to be recognized with minimum social protection, and their capacity building has to be done, which is very important. And we need to have a strong mechanism for monitoring and supportive supervision is important. Next, please. So while we have been working on the cooperative model for over 40 years, we also realize that sustainability is an important aspect. And there are the needs that were emerging from the community, from our members, from informal workers and their families, is that they also wanted to provide better education. And there's a lot of emphasis on education of children. And we, since last couple of years, we have piloted a model. We call it the Smart Center or the Other Center, and it's built on the approach of Seva's 4 decades of experience. The location that we have selected was part of the city's upgradation plan with more facilities and infrastructure, as well as a mixed economic profile. So where we've seen with both formal and formal workers or families that can afford better facilities. So an additional emphasis, like I said, on pre-primary education, using new and innovative methods, tools, and activities were introduced. And the facilities included larger activity area, additional teacher, guidance from a professional teacher, and after-school coaching classes with digital learning tools. All of these different things were added to it. And we also took some higher, in order to ensure sustainability, the parents started paying a higher fee. So what we realized was that for the informal workers, women workers, once they appreciated the value of the center, the higher fee was viewed as a worthwhile investment. So they started providing that. So that was the other thing that we came out of that came out of the study that we did on the pilot. The next slide, please. So what were the learnings from this? Of course, increased female labor force participation, and many of the women, they increased their work hours in that area. The mothers increased their work hours. They freed up time for their home-based caregivers to participate in community events and other household responsibilities. And some of them entered the labor force after a break. So that is something that we saw in this area. And the learning and the school preparation, the additional inputs that were given, it actually helped the transition into full-time school. We also learned that it had an emerging influence on social norms. There was a shift in gender norms around parenting, and particularly, like I said, the role of men in children's development. We were able to ensure that the men participated in the child's development, in their children's development. And of course, here's something we could, through these meetings, ensure shared responsibilities between the families, between the parents, and it's not just the mother's responsibility. And we also learned what really happened in this area. It was the first time that we set up this, there was a childcare center in that area and that locality. And soon we also realized from our evaluation that the families started recognizing the importance of women's work. And many of the mothers who had stopped working or discouraged from working, they were encouraged to go back to work. And that was something, there was a positivity around that. And the children's exposure to the creative and educational activities, the social skills, all of this, also the healthy habits that we brought in through the centers have also transformed many families, the views on the specialized skills that are required for ECD and preschool education. And finally, the learning that we had was the importance of the center-based care here and the stimulating environment in a child's daily routine, because many of these families had grandparents and other members they could take care, and initially they did hesitate, but here once they started sending their child, they realized how important a stimulating environment is for a child's development, overall development. Next slide, please. And finally, this is my last slide, Karina. I'll finish it soon. And scalability can be considered if you have a direct expansion of the models, but we will have to have appropriate financing and business planning. That's what we've learned. And some of the three key principles have to be transferred principles into the adapted model. So that's very important. The location we know was important, accessibility was important, and it had to occupy an attractive space that can manage a large range of activities. And the integrated approach was important. That's what the parents said. And very important is identifying local teachers who can be steeped in a value-based approach. And this can only come through regular training. And finally, what is so very important is we have to develop a trust in the community wherever we are working. So these were some of the key principles that, and of course, you have to ensure minimum quality standards. No matter, we cannot compromise on that. And the monitoring mechanisms have to be strong. So all of these key principles have to be transferred for scalability in a new area if you want to scale or if you want to replicate this model. So these are the two models I was asked to talk about. There are other models, but here you go, and thank you so much.
Thank you, Suzanne. Thank you for being considerate and accepting the request of only for sharing two models. I understand how difficult it is for Mobile Crush and Seva to limit themselves to one or two models, because their work has been not over just 2 or 3 years, but it's been over decades, 50 years or 40 years and 60 years to say so. But yeah, last but not the least, we have Arunima with us from EY to help us understand the funding mechanism a little. Also, thank you, the participants, for keeping the chat section very active and lively. I request my panelists to kindly address the questions they would like to, and please continue to use the floor for asking more questions. Over to you, Arunima, please. Do we have Arunima with us? Arunima? Yes. Kindly unmute yourself.
Thank you so much, Karina. And it's such a wonderful opportunity to be part of all the great practitioners and on the day that we are meeting today. So very quickly, I know time is of essence. So, and I think I have 6 minutes.
Less than 6 minutes now, please.
Then I'll have to be very quick.
Yes,
and
please.
also, Sumita has gone before me a lot of context in the Indian scenario she has already touched upon. And as we discussed, one of the things that I want to highlight is the localized nature of the care models some of the states are executing. And 2 states specifically I will be touching on. That has also been referred to by Sumitra. But first and foremost, I'll just share very quickly. EY is working at the 3 administrative levels in the country at the national level, where we are supporting on the policy formulation and the technical aspect with the central government and other development partners. At the state level, that is the next administrative level in the country, we are partnering and supporting state governments as Haryana, where Sumitra and Mobile Crashes is the executing partner on the ground for the model specifically. I'm having a little bit of an overarching view on Haryana, where I'll be touching on. And after the state level, it's the next administrative level of district, which is around India is having right now more than 780 districts, and closer to the grassroots where the actual activity implementation is happening. Though there are, of course, that, but I'll stop there. So what is common between the two states that I'm touching upon? So first, Haryana is a North Indian state with a very strong economy, sharing borders with the national capital of Delhi, relatively smaller geographically. And the second state, Orissa, is on the east coast of the country, much larger geographically, mineral rich, but high incidences of very high poverty indices, a lot of climate fluctuations, large communities, indigenous communities who are classified as scheduled tribes under the constitution, and it has huge pockets of mines. Mining is one of the largest states with mining happening, and that is a very crucial context in the care models that I'm sort of touching upon. A couple of more things that are common and then divergent also among the two states. One is establishing the care models and recognizing the specific needs of the community. Understanding those intersectionalities on the ground and incorporating that design in the care models. That has been a very thoughtful approach that EVA has been working on with the partners. As I said, largely with the government partners and the non-government partners in forms of multilaterals and civil society organizations. Also recognizing the fact that addressing care as a model, there's no other way than a convergent way to go ahead. Be it tapping technical expertise, be it tapping institutions, and be it tapping funds and resources. So that is some of the common grounds that I just wanted to establish before going to the specific models. Karina, can someone help me in going to the start of the model? Yeah, so because of course, these are some of the common pointers that Sumitra has already shared. I will not go into the details, but largely the care models are addressing early childhood care and education is an integral element in both the models. Both the states are having high incidences of child stunting, malnutrition, anemia, and that's why addressing the nutritional aspect of child well-being is another important element of these institutions. And larger empowerment of women, primarily by reducing the care burden and also recognizing that the redistribution of the care responsibilities is a critical element. So these are a few of the things that have been incorporated in the design. Can we just go to the next one, please? So just a couple of points I wanted to highlight in Haryana, and I see also questions on the timings of the care institutions. So a couple of non-negotiables that the institutions established in both the states were that the centers were operational for at least 8 hours in a day, thereby allowing greater free time for women. Also, another evidence from the ground had emerged on how the elder child in the family used to be involved in taking care of the younger siblings, thereby impacting their education and school dropouts. So this was an evidence which was used and incorporated in while taking care of the times for which these institutions would be open. Another was, of course, the age group of the children, which as in Haryana, it is from 6 months to 6 years. Especially addressing the gap where the traditional Indian government and Anganwadi systems were having 3 years onwards. And of course, the cost, this very quickly I'll touch upon because Karina, I know you wanted me to speak more on the funding aspect of it also. In Haryana, largely it is a state government driven initiative where the government is identifying the requirements and needs. The department is also running its own primary assessment on the ground with their own child development officers, assessing where the location of these institutions should be, developing the whole design and proposal and internally identifying funds within the state to utilize this. And a very important thing, which Dr. Valeria also had highlighted on, that the quality of care is so directly related to the quality of work and thereby the quality of the cadre of care providers. So the emoluments of the care providers here is one of the important things which the state has taken an initiative to keep at one of the highest levels in the country. We can go to the next one. So, all right. Very quickly, I'll just touch upon the model in Odisha. So, while Odisha larger has, of course, the state has a variety of care models. One of the unique scenarios in the state is its mining regions. The mining regions, there is in the state a trust established called the District Mining Fund Foundation, in which the various mining, the private sector mining entities contribute funds, contribute like there are contributions of the royalty amount for the lease that were granted before 2015. And this fund is parked under the trust, for which at the district level, and I'm at this point of time, I would just want to draw the attention of the group. It is not even at the state level. Here it is, the district entities are functioning very independently with the district collector or the district magistrate's office taking a leadership here in identifying the needs and requirements of the particular district. So, for example, in Kyonjhar, one of the key areas, as as I referred earlier, was the child nutrition status. There was more than 37% of stunting and children being underweight. Wasting was more than 23%, and the severely wasted were nearly more than 6%. And for this reason, there was an emphasis on bringing institutions under this fund foundation, where the complete focus was on early childhood care. And also, as I referred, on reducing the care burden of women, considering these institutions were for the local community, which were largely minors. And the women in these communities were either directly or indirectly involved in various activities and functions related to the mines, and it was a source of their livelihood. So, from this point of view, more than 200 operationalized creches were benefiting more than 6,000 children, and there was an assessment study that was done around, I think, 2 years back, and the reduction in percentage of underweight children through the intervention of these institutions was 25%, and a wasting reduction of 64% was reported. And there was also a reduction in the severely wasted children percentage to 78%. So this is just touching upon the impact and the direct linkage with women's reduction in care burden to free up their space, free up their time for their other opportunities for them to access. And I'll just quickly also touch upon how the DMF fund is utilized. So the fund, as I said, through the percentage contribution of the royalty amounts, is parked under the trust. And the departments play a critical role at the district level, where they do their need assessments and identify the gap areas and the specific needs of the community that they want to cater to. And a design of a program is developed, which is presented to the district level DMF executive committee. And after the design of the program is approved and finalized, the request for approval goes to the DMF fund, and when the approval is released, then the departments initiate the process for onboarding implementation agencies, which are largely civil society organizations, for-profit organizations, to execute it on the ground, manage it on the ground, and on milestone basis. Requests is raised by the departments to the fund trust to release payments for addressing each of the milestones. I'm just covering it very quickly, not to take that extra time, and I think it's done. And I will just highlight a couple of gaps and challenges that in our nearly I'll take about half a minute more, Karina. some things like bringing in, when we are saying children from 6 months to 6 years are being, are given a benefit of these institutions. But through our experience, we are also realizing infants, very young children, need another level and a different degree of care. So the cadre front facing has to be trained for it. The institution has to, or the infrastructure has to cater to those requirements. And those are still gap areas. Convergence is required between the various development players, and private sector needs to be present much more in the process, because in identifying and getting stable infrastructure in addition to the nutrition and cadre strengthening is something which is the need of the hour right now for these institutions. Policies, of course, the national policies and the state level policies are driving it, but for the better execution, this partnership is very critical. And agencies as EY are playing an instrumental role in driving these agencies and also sort of supporting that technical and larger convergent the support and system strengthening. So that's from my side. Karina, I'll stop, and over to you then.
Thank you so much, Arunima, and our participants. It's been very lovely to have you here. Also, with respect to the questions, a lot of questions being asked, and just for the other participants to know that in the Q&A section, when you move towards the answered tab, as you click on the answered tab, you'll find the questions that have been answered by the panelists. But mostly, if I could summarize, there are questions regarding what kind of a support, what percentage of the support from the government that is required to run such care programs and services. And Ms. Youngmi from Korea has been able to provide an exact percentage and also the budget that is being allocated. Also highlighting that the question which was about how are we adapting to the varied demands. So she has specifically mentioned that it is heavily dependent on the data collection and also the demographic shifts, which again requires the need assessment and data collection to be done at the time when we are designing these policies and programs and the implementation strategy. More of the questions for Seva and Sumitra around like the number of hours and the flexibility and the age groups for which these programs are for which these care models are open for. But I think the questions which are still open and would like to one or two of our panelists to address is around for one of the questions that I would like to pick is or merging the two of them is the standardization of the processes in the childcare model and the scalability regarding it requires the documentation and data, and how can we address this challenge of scalability with standardization and with the need of diverse kind of funds. So how can we have the funding mechanism or mobilize different kind of funds? At the same time, how can we ensure the standardization and the collection of the data? So these three different elements, I request the panelists to maybe we can begin with Sumitra because I see her responding to that question already. But yes, over to you, Sumitra.
Quickly on the standardization of norms, and I'll attempt the scalability question. Standardization of norms, I think it's not rocket science. The norms have to be identified and they have to be practical. There has to be costing and budget available to implement the norms. Training, repeated trainings for adherence to the norms is required. Training across multiple cadres so that everyone across the cadre knows their own role around the norms and therefore their accountability. Important component, what Susan had picked up, community ownership is important. No norms can be standardized, no quality can be standardized unless the communities own it. Therefore, local creche monitoring committees, all of that is important. And of course, what we've seen and learned from the Palna scheme and the earlier national creche schemes is that regular fund flow, close monitoring, identify team members identified administrative structures are necessary for standardizing norms. Otherwise, they can still be great on the paper, but hard to find on the floor. Scalability, yes, the question about evidence and impact and outcomes is evidence on impact and outcomes helps in the scalability. And we must talk about getting the evidence mapped, and ENY is here, multiple UN organizations are involved. I think we must get the evidence mapped, and I'm not undermining it, but in India, my reading of the lay of the land right now is that we have to just allow 1,000 flowers to bloom, multiple creche models to bloom, and then once we have a variety of models, as we're gathering evidence, then we can position one over the other or multiple models. If we start limiting by saying that we haven't got sufficient evidence on this model outcome, then we will kill the program even before it has started. So I will take it with a little bit of pinch of salt, that collect evidence, but be careful about what we are advocating right now. It's a green field right now.
Thank you, Sumitra, for answering that question. And I see Sumitra also responding to many of you asking about how are they aligning with the FANA scheme. Also, in terms of the childcare policies and the infrastructure is expensive, so what are the good financing mechanisms? And as she has mentioned, and the very objective and essence of this webinar was also to introduce the different global models, that how have they been able to mobilize funds, and how one of the Korea model that we talked about today. And yes, the later models also are one another, and specifically within India, these very local models in Haryana, Odisha, and one of the funds, the DMF fund, Arunima has mentioned about, are the ones we need to go back and look into. One question for Maria is regarding the training and caregiving, that in that region, what has been the licensing process for entrepreneurs in the care services like? Does it require more literacy than the median literacy rate for women in country? And is there a financial commitment in the licensing process? Why I'm taking up this question, because this is very relevant in Indian context as well. The designing of the training program, where the eligibility of a trainee needs to be of a certain education level and qualification, and also to pay for those courses also creates a barrier for those individuals to get themselves trained. So Maria, if you can just help address this question. Over to you, Maria.
Thank you, Karina. Yes, the level of education is very important, although that in our country, North Macedonia, the primary and the secondary education is compulsory. So there is still a number of people that hasn't completed the primary education. So UNDP is supporting different programs, working together with the Ministry of Education and the Center for Adult Education. We have provided and supported the development of system that is providing an opportunity to unemployed people that haven't completed primary education to enroll, to be assessed, and also to have an opportunity and to be supported free of charge, supported by the government and by the programs in order to complete the primary education. So there are different levels of additional support in order to enroll the training in order to become service providers. So in this active employment measure that we are supporting the government to implement in order to expand and to develop the network of care services and care providers, because our support to have a sustainable system, and we are also supporting the licensing procedure. So there are two levels of licensing. One is the licensing procedure that the service providers as an entrepreneurial center, as a company that need to be licensed. There are certain technical criteria that the service providers, the NGO that has applied for support to fulfill in order to establish the care services and to provide the services to the citizens in need. One of the criteria that the service providers as a company need to fulfill is to have trained caregivers and those caregivers to be employed. So in order to expand the service provision throughout the active measures, UNDP jointly with the Employment Service Agency and Ministry of Labor and Social Policy is covering for the cost for the people that are enrolling the trainings during the training period. The training costs are covered, but also there are covered other additional costs that the people can have in order to follow up the 3-month training. These trainings are verified, are provided by the verified training providers that is recognized by the Ministry of Education and the Employment Service Agency. And when the people follow up and get the certification, then they are eligible to be employed in the service provider as part of the criteria that need to be fulfilled in order to have the license. So the service provider is licensed, but also the caregiver is licensed. Throughout the program that we are supporting, we are also subsidizing in period of 10 months the employment, the formal employment of the caregivers, but from the other side, in order the service providers to fulfill the criteria, the technical criteria throughout the grant scheme, we are also supporting the NGOs to fulfill technical criteria that are related with the accessibility, with the space, with the aspects of universal design, because the idea is the care services to be open and to provide the services to the families and the people in need, no matter whether they have physical disabilities or sensoric disabilities or are facing other challenges. So we have introduced and implemented and piloted the completion of the primary education with the group of citizens that are part of the Roma community, Roma returnees. And there are two groups in this the second half of this year that has enrolled the competition, the training and completion of primary education, and now around 60 people has received the certificate for completed primary education, and now they can enroll in different training programs or different measures and to be employed in the different employers, but also there is an opportunity for them to follow up, to enroll the secondary education, or to apply for different grant schemes in which they will gain support to become an entrepreneurs. And when we are talking of self-employment, especially of employment and self-employment of persons with disabilities, throughout the measures are also providing the trainings in which people are developing their entrepreneurial skills, and also they get support from the business mentor to develop their business plan. And all this is covered by the program.
Thank you, Maria, for this complete answer, and also talking about the supplier side, means employer side, and also the caregivers. Before we conclude, a very interesting question. I think my panelists would also like to hear it. And thank you, Dr. Valeria, despite having a medical condition, to answer it over the chat. I would like to bring it up that one of the participant, Vidisha, asked us that are there chances, since this formalization and professionalization of the care service and the care sector is about to happen, will it become male-dominated sector? And do we need reservation of jobs for women? And Dr. Valeria has responded that there are many professions which are dominated by women, and the more feminine sections of this care workforce are the lowest paid occupation. So much so that there are still gender pay gaps within the care sector. In a nutshell, as these sectors continue to be highly feminized, Dr. Valeria don't think that we are any close to require reservation jobs for women, and focusing on the creation of good jobs and for women to benefit from their creation. Thank you, Dr. Valeria, for this answer. And thank you, everyone. I know we are too much ahead of our planned schedule, but since the conversation and discussion has been so interesting, and I hope it have been meaningful for all of you. So all of these global and national, like Indian model, together are these initiatives which kind of have provided an outline or a blueprint to influence and the inspire to create, design those interventions which can help create these initiatives or models and even the policy changes scalable, because once the policy created at the state level needs to be scaled at the national level within the other cities and states as well. So all of this will help us to scale, be inclusive, and move towards a more transformative and accessible childcare systems to empower women and contribute to their societal well-being. I thank you all my panelists and my colleagues also to help us organize this and provide so much of knowledge. And many congratulations once again, everyone, for recognizing and celebrating with us the second International Day of Care and Support. Please do take care of yourself and feel free to share the care responsibility with everyone around. Thank you, everyone. Thank you so much. See you very soon.
Thank you, Karina. Thank you, everyone. Wonderful being here.
Thank you,
Wonderful.
everyone. Bye.
Thank you. Bye.
Without much further ado and delay, because the technical glitch has kind of broken the flow earlier itself, I would request Dr. Shiva to kindly take the floor over and set the context for today's very important discussion. Over to you, Dr. Shiva.